every now and then we see somebody where they're like, yeah, ever since I was a little kid, I wanted to be an acupuncturist, but that's usually not the case. We usually kind of stumble into it at some point. So
Mhm.
what was your story? How did you get to this career path?
Well, I definitely stumbled into it.
Right.
um, my so when I was young, I always wanted to be a doctor. And so, that was the career path I had chosen initially. So I went to medical school, graduated,
Oh
did
wow.
a 12-month internship. Um, and immediately after that, I applied for the naturopathic medicine degree at the National University of Natural Medicine um, in Portland. So I did the first term of that, got about 6 weeks in and hated it.
Oh wow. Oh no.
It
Okay.
really wasn't what I was looking for. I was really looking for something that was holistic in
Yeah.
its mindset, in the approach with patients. And lately, like naturopathic medicine is amazing, but the program had changed that year and had become a little bit more allopathic than I had liked.
Mm,
Um, so I switched over to Chinese medicine, just like kind of on a whim, because there were a lot of duals in my program and I'd heard a lot of great things. And so I was like, I'm just going to try it. So I did. And I loved it. It was pretty much everything I was looking for. And
awesome.
here we are 5 years later.
Yeah. Yeah, that's amazing.
I didn't do the biomedical stuff in school, obviously. I got credit for that.
Yeah,
So
nice.
I don't know exactly what was taught, but I'm like, I guess that it would be just learning the lingo, learning the language, learning the diseases, getting familiar so that you can translate those terms, Eastern, Western. Um, but what you don't get a lot of exposure to is like how medical procedures are done and lab tests and um, how things are typically treated in the Western medical realm. And so I have some familiarity with that, especially in the hospital setting, since that's where most of my medical education is. Um, so that has been really helpful with a lot of my interactions with patients, um, especially the ones who are like, I have been to see a bunch of specialists and I've had done this test and this test and this test. And I'm like, okay, yeah. And I know what all of that means.
Yeah.
And it seems to put them more at ease, that I can understand a little bit better what that means for them and what their experiences were like.
Yeah.
Yeah. So
Yeah. And
I
that's
think
just
I can relate differently.
yeah, for sure. And that's just so common for most folks when they're coming to see an acupuncturist. It tends to be, at least in the US, after they've tried a lot of different things.
Yeah.
Unfortunately at this point, acupuncture isn't thought of as like, oh, I'm starting to have issues with my health. Let me go see an acupuncturist to see what they can do for me. We could do a whole lot for them at that
Hmm.
point. I mean, this medicine, its sweet spot is honestly with prevention and helping people when they're first starting to show signs and symptoms. But it's
Yeah.
usually folks who have I mean, in a lot of cases, exhausted what they can do through the Western medical model, and then we get them,
Hmm.
and they're like, "What can you do for me? Help!"
Yeah, pretty much.
Just, we can take care of them too, for sure. That we've just got a lot of different tools in our tool belt, which is great.
So Japanese style acupuncture is like the theories and philosophies are still based on all of the same Chinese medicine principles. But I think where the difference is in the way the techniques are used. We use something called the tation or a non-insertive needle, which sounds modern in a way because you don't see acupuncturists use it generally unless they're Japanese style. So it's like, oh, well, this must be just like a new thing that they came up with, except it wasn't.
Right.
The Taitian is actually one of the original 9 needles that we learn about in Chinese medicine school. And so it's just as old as the medicine, but I think somewhere along the way it just kind of disappeared on the Chinese side, and the Japanese seemed to pick it up and went crazy with it. So,
Yeah.
it's a lot of what they use. That's for a lot of Japanese style acupuncturists, it's their primary needle style. Like they don't even use insertive needles. Um, and then those that do, they use like the really, really small, thin um, gauge needles that are like um, just shallowly inserted, like not deep, not heavy stimulation usually. Um, and so that's how it's got the view of it being a more gentle style of acupuncture. The first one that comes to mind is children.
Okay. Yeah.
Yeah. So a lot of pediatric acupuncturists are familiar with Japanese styles because of the non-insertive work. Like children are seeing as having so much energy within them, and so it's not even that we need to do a whole lot for them. It's just a matter of regulating what they already have. It's definitely been really effective for folks with anxiety and helping to calm the nervous system. Um, or even if you like don't have a sense of anxiety, like there's just um, like there's just some sort of stress within the nervous system. That agitation, it helps to calm that as well, I find.
Yeah.
Most of what I do is myofascially based though. So um, I have a very high interest in fascia that I developed in Chinese medicine school.
Right.
I went into doing some shiatsu. So, like even now, I still incorporate a lot of shiatsu into my treatments. Um, and then there's myofascial release itself. Do a lot of that. I do a lot of cranial sacral and sotai. So sotai is a Japanese style of body work, which is basically a form of neuromuscular reeducation. So basically reconnecting mind and body. It's one of my favorite things because people are so disconnected with their bodies that they're like not making some of the movements and they think they are, or they're like,
Uh,
I don't know how do I do that. And so it really, really connects them in that way. The most important part of it is that it works with your breath. Since the breath work is so like inhale and then slow exhale as you make your movements, like it really activates the vagus nerve, I think. And so Sotai can be so relaxing in that
mm,
sense. Again, calming down the nervous system um, while making those connections in the
yeah.
brain and in the body again. It's kind of magical.
I mean, I could just see how that could be so effective because you really are retraining the nervous system to, you know, do all of these different movements while it's in a really relaxed state so
Yeah.
that when you're going about your day and obviously doing some form of these movements when you're walking or driving or whatever, and
Yeah.
it can kind of go back to that memory of, ooh, last time I did this I was in a really relaxed state, so let's hold on to that the nervous system is so good at holding on to those memories, good and bad memories.
Yes.
If
Yes.
you're super stressed all the time, your nervous system kind of goes back to that state. But if you can train it to be more relaxed, then
Yep.
I could totally see how that would be super effective.
And so much healing happens at rest. Like
Yeah,
that's where your body heals. It doesn't heal. It's not thinking about healing if you're like in your fight or flight response because you're like
it's survival, right?
yeah,
Yeah,
you're
it's
you're like
survival in that state.
I'm not in the state to heal myself. I'm in the state to just like survive life,
Yeah.
whatever's happening, everything
Right.
around me.
Yeah. So if you can get it back into that rested state, that parasympathetic nervous system activation,
Yeah.
then you can actually get things to happen. Like digestion's going to be better, immune system's going to be better, all the good
Yeah.
things.
Yeah. I definitely think that a lot of the work that happens is outside of the treatment room. And so while I do a lot in the treatment room, like I would love for it to stick around in the body. So,
Right.
like there's just depending on what the issue is, like say it's a pain patient and they have um, say shoulder pain or wrist pain or something, and like you could go home and you can do sotai on yourself. Like I can teach you to do that. You can go home and you can do moxa on yourself. Yeah, I don't think everything should happen in the treatment room. That's 1 hour that you spend with me. And then there's the rest of your life that you do every day, 24 hours, 7 days a week,
Right.
So
you can undo a lot of that, huh?
yeah, and I think it's really important for people to be invested in their own health. And so, and that's not just, with money or anything. It's definitely with how much time you're putting into taking care of yourself at home. I'd say what I do is pretty unique. There are not a lot of Japanese style acupuncturists in Portland. Like Portland has acupuncturists everywhere. You could throw a
Yeah.
rock and you'll hit an acupuncturist store.
Oh yeah.
But
Okay.
they're everywhere. Acupuncturists and NDs alike. But
Ah,
a lot of them are not Japanese style trained. And so I don't think we're very common, which is interesting and unique.
that's great because I mean, even for people who have potentially tried acupuncture in the past for whatever issue, if they're thinking
Mm-hmm.
about trying it again, this really is a different type of acupuncture.
Mm-hmm.
Um, and I mean, we're like you said, we're working with the same theory, but it's quite different.
Yeah.
There's such a big need for this type of medicine. There's a huge need for conventional medicine too. I'm not saying that that's not needed. I mean, we absolutely need that.
Absolutely. Definitely. There's a place for both in the world. There's no need for a divide. It's not natural medicine and not so natural medicine. Like it's not like that. And I don't think it should be.
Yeah.
And maybe it's because I've been trained in both, but I feel like they have the potential to work really well together. And you can see it in China. Like acupuncturists are all over in all like the Chinese hospitals in China.
Yeah.
They work
Yeah.
together. And that's proof that they can work together. It's usually questions about like the theory of what I'm doing. Like, what's your um what's your thought process about what you're doing?
Yeah.
Or why are you always at my belly? Or
Yeah.
like little things that I do along the way. Um, yeah.
A lot of people are really curious about the techniques that we use because again, they're just so different from what they've been exposed to. And it's
Mm-hmm.
because, when this medicine was developed, however many thousand years ago, we didn't have blood tests or MRIs or all of these other diagnostic tests that we do now. So it was, like you said, palpation based and observation based. But you
Mm-hmm.
can learn so much from a person just by feeling what's going on and inquiring, like, oh, you have this symptom at this time of day and you're also having this symptom. Oh, those are probably connected. Like that,
Yeah.
it's an art that I'm so happy is not lost. It's definitely still around and thriving in the Chinese medicine tradition for sure.
Yeah. Yeah. I love that you said art because I consider it like that too. It's
Yeah.
totally an art. Like you get it better and better with practice, like art.
Mm-hmm.
But um there's so many connections, and they're so unique and individual from person to person, and you can always be surprised.
Right? Yeah.
Yeah.
And I mean, and just that, I mean, that aspect shouldn't surprise me, even though it does, that people are different and that, you know, that their bodies are going to react differently from their neighbors. Like, of course, right? If you sit down and think about it. But yeah, it is amazing, just the different needs of different people, and how different somebody can go through, or two people can go through the exact same stressors or exact same traumatic events, but because of, you know, genetic predispositions or
Mhm.
childhood trauma or not trauma, you know, they can have completely different reactions
Yeah.
to that stressful event. And treating those people with what they're coming in with feels like what medicine should be to me. You know?
Yeah, like I'm not someone who can just come up with a plan for a treatment before I see a patient. I actually had someone ask me that once recently.
Yeah.
Like, oh, do
Yeah.
you know what you're gonna do every time I come in? Do you have like a plan? I was like, no. I
No.
just wait till I see you, and then I just do what your body tells me to do.
Yeah.
Like,
Makes it easy
I'm
on
here to
us,
listen
right?
to your body, that's what I'm here for.